Dr. Scott Sigmund. Welcome, Marcelo Cunha. Welcome to the Valder Beebe Show, both of you. How are you guys during this soccer season?
Fantastic. Thank you.
Go Team USA.
Well, it's so exciting in Dallas with the FIFA World Cup. Let me tell you, people have lost their minds, and I'm so glad to have a chance to talk to both of you. And I'm going to start with Dr. Sigmund, because one of the things is I don't hear people talking about ACL tears in relationship to what's going on with soccer. So give me some of the risk and how this relates to people playing sports.
Yeah, it is all about World Cup right now. Obviously, soccer is on everybody's mind, but the truth is that ACL injuries occur in most sports: football, lacrosse, field hockey, skiing, soccer. And the reason is that the knee joint is a hinged joint. It doesn't do very well with rotation. So in any sport in which you're stopping or starting or pivoting, you're potential risk for tearing your ACL.
Tell me about this Bayer implant that they told me that you could speak on for me.
Sure. I mean, when most people think of ACL injury, they think of ACL reconstruction, and that's been the standard of care. So when you injure your ACL, classically, we would remove the ACL tissue. We're going to drill a couple of holes into your bone. We're going to take a piece of tissue from your knee, whether it's your hamstring, your quad tendon, or your patellar tendon, and we're going to replace it. We're going to reconstruct your ACL. With the Bayer implant, what we're doing is taking advantage of the human body's incredible ability to heal itself. And so what we'll do is we're going to suture the ACL. We're going to keep it all there. We're then going to take a novel collagen implant. We're going to lay that over top. We're going to draw some blood, and we're going to put that over top. And now we have an environment where literally we can get the ACL to heal. Really quite remarkable.
I want my audience to know that Dr. Scott Sigmund, he's an orthopedic surgeon and comes well qualified to talk on this. Marcelo, I'd love to ask you, tell me about your ACL injury. Tell me a little about that and how the Bayer implant intersects for you.
Yeah, so I unfortunately tore my ACL playing soccer, and I consulted with Dr. Sigmund here, and we talked about the Bayer implant being the best option for me. I was really drawn to the fact that my own ACL, with the help of the implant, would repair itself. I was pain-free due to it wasn't so invasive as a traditional ACL surgery. And so I was walking around the next day, starting my PT journey, and it's been fantastic. I've been gaining strength on that leg and gaining confidence back in the knee so that I can go back out there and do what I love and coach.
Well, Marcel, I'm so glad you're here to share your story with my listening audience, because a lot of just everyday athletes told me that they can relate to the ACL injury. So thank you so very much. And I'm going to wrap up with you, Dr. Sigmund. Tell me about who would be right for this, because, anyone with an ACL injury, I'm sure they're trying to make notes of how to get it fixed.
Absolutely, Valder. I mean, the FDA has approved this Bayer implant for the age of 2 and up. So whether it's an adult, whether it's an adolescent or a pediatric, I've done them in 14-year-olds all the way up to 65-year-olds. The timeline actually doesn't matter either. If you've been diagnosed and you just haven't been able to get to the doctor and it's 3 months or 6 months, if there's viable tissue, we can still do the ACL repair. And then for patients that are really interested in long-term knee health, the FDA has really taken a look at the data now. We have 6-year data for our patients that have undergone the Bayer implant, and there's literally a 6-time reduction in the incidence of arthritis after a Bayer implant to the knee versus undergoing an ACL reconstruction. And in my 30 years of clinical practice, that is truly profound.
I want my audience to know that Marcelo Cunha, he's a soccer coach and a Bayer implant patient. Doctor, where do we go online and get more information? Because it doesn't seem you have to play soccer to get some help, right?
That is true.
You got an ACL tear.
We're going to keep it simple, though. How about BayerImplant.com/soccer? It's about the World Cup. So BayerImplant.com/soccer is where you can find more information.
I want to thank you both for stopping by and talking to my audience on the Valder Beebe Show. It's been a pleasure.
Thank you.
Thank you.
Hi, I'm Valder Beebe, host of the Valder Beebe Show. We have over 1,000 videos on ValderBeebeShow.com and YouTube.com/ValderBeebe Show. We upload new videos daily. Our site is a modern baby boomer platform with news and information important to boomers. Subscribe to youtube.com/ValderBB Show and stay connected as I interview the world's most fascinating people.